Hello, everyone, and welcome to another episode of Arthritis at Home. I'm Kelly Lenvoy, VP of Communications and Public Affairs at Arthritis Consumer Experts, and I'm happy to host this episode on the upcoming Alberta election, what it means for Albertans living with arthritis, and what some of the key issues are for those people. Arthritis in Alberta affects more than 650,000 residents. It's the leading cause of disability in Alberta, and it imposes a significant economic burden to the economy related to direct healthcare costs. And those can include doctor's visits, nursing services, medications, medical devices, and what we call indirect costs. And those are things like lost employment, sick leave, and absenteeism. Joining us today to talk about the upcoming election and the important issues for Albertans living with arthritis is ACE's founder and president, Cheryl Cohen. Cheryl, welcome to the program.
Thank you, Kelly. It's a pleasure to be on again with you.
Recent polls, Cheryl, have showed that healthcare delivery at 46% and cost of living issues at 47% are by far the two highest named issues by Alberta voters leading up to the May 29th, 2023 provincial election. And what we know from our experience is that healthcare delivery is also a really important issue, a critical issue for people with arthritis. Maybe to start off, you can describe to our viewers and listeners, what does it mean for patients in Alberta when we talk about healthcare delivery?
Sure. So I think that statistic you just shared about the what is top of mind for Albertans in terms of going into the voting booth is not a surprise. Healthcare, generally speaking, is always at the top of the list for voters in Canada. And that obviously is true provincially as well. When it comes to the issues that matter most to Albertans living with some type of arthritis, there are over 100 different types. The primary issue, Kelly, like it is everywhere in the country pretty much, is how to access and receive the kind of healthcare they need. And the issue is that it varies significantly across the province. It's not a surprise that this is worse or more pronounced outside of the greater Calgary and Edmonton regions. So where you live always matters when it comes to whether you're reasonably satisfied or not satisfied at all with your healthcare access and delivery. So this kind of disparity across the province or inconsistency adversely affects Alberta voters who particularly are living with inflammatory arthritis, types like rheumatoid arthritis, the type that I have. And the reason being they depend on getting a timely and accurate diagnosis. And so timely access to a rheumatologist, the specialist physician, Kelly, as you know, that delivers that diagnosis, is most expert at giving that diagnosis, and appropriate public reimbursement for needed disease-modifying medications are two really critical pieces in terms of how quickly you get into the care system if you're experiencing an autoimmune form of the disease.
Right. So healthcare delivery, I think what you've clearly pointed out here is sort of that distinction between most of those 650,000 Alberta residents living with arthritis have osteoarthritis, and then a smaller percentage, about 1% of the total population in Alberta who live with inflammatory arthritis. With osteo, those people are looking to get cared for by their doctors or their physiotherapists, whereas IA, inflammatory arthritis, as you said, is dependent on a rather complex healthcare team led by the patient and their rheumatologist, and
Exactly.
that access could be very challenging.
Exactly. So we like to say this is not sort of a defamatory or pejorative statement at all, but people like me who have an autoimmune form of disease, and it's sort of in that moderate to severe range of disease activity, Kelly, we're known as heavy users of the healthcare system. And timely diagnosis and timely treatment, both non-pharmacologic and pharmacologic, is critical in terms of the outcome that individual patient receives. Whereas osteoarthritis, equally as important, but the trajectory of the disease onset is slower. So you have a bit more time at times to sort those things out. And the problems that people with osteoarthritis in Alberta face are very different and relate to basically having a knowledgeable primary care physician, someone who actually can tell you about that diagnosis, which they often don't, Kelly, give you self-care things to do. Like in the early stages of osteoarthritis, we can do a lot in our own homes, in our own communities. But if you don't have access, if you can't get a family care practitioner, or you don't have a physiotherapist who has some additional arthritis training, you're hooped, right? So it's two different sets of people, but with very important problems addressed in different parts of the healthcare system.
So you've identified these gaps in the delivery of healthcare, or what we often describe at ACE as models of care for arthritis, both osteoarthritis and inflammatory arthritis. Let's dive into now the election advocacy that ACE has recently activated in Alberta. And it's really part of a process that ACE has actually become known for, I think, across Canada, Cheryl, and that is the work we do around every federal, provincial, and territorial election. Before we get into the specific issues in Alberta, maybe you can tell the audience just a little bit of background in terms of what goes on behind our election advocacy platform every time there is an election that occurs in Canada.
But ACE really was founded to change the arthritis experience for the better for people living with the disease from coast to coast. Everything we do is by, for, or with people with arthritis. And their voices, our voices in this healthcare discussion is critical to helping shape health policy. And you do that through this advocacy process by collecting information from people like me across the province and asking them what it is they need and want, and where and when and how much, and then turning those voices around and amplifying them at government through our election advocacy platform. And as you said, Kelly, we've been doing this for 20 years now. So we know how to do it. We're told we do it well. And it's all transparent. So everything that comes in from an elected official that is currently in office, or someone that is running for office, or a party that is trying to form government, we turn the input that they give us around so that voters, people with arthritis, and there are so many of us, we have real power in our pen. So it's about putting your voice to your pen and ticking the box for the candidate or the party that you feel is really going to pay attention to arthritis, which has been a historical problem for our disease group. We're one of the largest in the country, yet often are very low down on the priority list because of misperceptions of arthritis. So our advocacy, our election advocacy platform on our website, Kelly, www.jointhealth.org, and there's an advocacy tab along the navigation bar, is there to inform voters and to help voters to help shape that public policy, as I mentioned before. Elections, I think the most important thing I can say to our audience, Kelly, is during election time, people are listening. Candidates are listening. They understand that their chance of getting elected are greater if, in fact, they can listen to their constituents. So if they go out in community, Kelly, and we, the arthritis community, aren't saying anything, they've got nothing to listen to. So this is a really important piece of the work that we do every day, really, in our advocacy sort of column. If you were to, build columns across the worksheet, our advocacy column would be really chock-a-block full of election activity. And the people that we serve are our partners in that. They might not view themselves that way, but we do. There are equal partners in helping shape policy around health.
The key foundation around our election advocacy is a survey questionnaire that we send out to all the major parties and the candidates running for those parties. And as you described, Cheryl, the first key step in us developing that survey is listening really carefully to our members, and in this case, our members in Alberta, who help us identify what the key issues are for people living with arthritis in Alberta. So after we conducted that work, we developed a questionnaire. Maybe we can just do a little quick dive right now and explain to the audience what it is we're exactly asking the candidates in Alberta.
There are 5 questions, and some of them are quite high level, but some of them are very, very specific. So first of all, we're asking candidates who wish to, along with their party, form government. What will your government do to bring a high quality, accessible, standardized, evidence-based model of arthritis care for all Alberta residents? So that's the who, what, where, when, and how much sort of model that every disease community hopes to have to ensure that the people in the community can receive the best type of health care. So we're very, very eager to hear what candidates have to say. The second question is, what will your government do to ensure the continuation, improvement, and expansion of virtual care for all Alberta residents? So both for patients, Kelly, and for healthcare professionals, and ensure that access to that is equitable to all. You're going to hear this word equity and equitable a lot in this questionnaire. The third question is, will your government introduce culturally appropriate, patient-centered policies, such as a patient care facilitator or arthritis liaison, to help Indigenous peoples navigate the healthcare system and receive coordinated care within their community to manage their arthritis? We know right across this country that racism exists in our healthcare system, and that is certainly true for people who are Indigenous who are living with some type of arthritis. The healthcare system is not built to serve their specific needs, much in the way that it would be built to serve a colonial patient's needs. So it's a very, very important question we ask. Number 4 is, will your government take steps to ensure timely, specialized care for Alberta residents struggling with osteoarthritis, including, of course, joint replacement surgery, wait times that are within medically recommended guidelines? There have been these quote unquote tame the waitlist projects historically, Kelly, over the last 2 decades. The wait times had actually gone down, but because of the pandemic, like for a lot of communities who are struggling with a health condition or disease, they've gone back up. So this is really problematic for our many audience members and members across the province. And then 5th, the last question is, what will your government do to improve access to early treatment and pain management for rural residents in Alberta living with osteoarthritis who are at risk for increased disease severity and reduced quality of life? So I mentioned at the start of this conversation, Kelly, that osteoarthritis, while it may be more slow burning in terms of its progression, to severity. But when you think about osteoarthritis, the end stage of osteoarthritis is what we call joint death. It's where the joint cannot work anymore. You cannot walk without excruciating pain, so you don't walk. What happens? You become deconditioned. You may gain weight. You may develop another problem such as diabetes or cardiovascular condition. So osteoarthritis is a bit of a linchpin for a constellation of other health concerns, and we call these comorbidities. So it's a driver of other things, or it's a follower of other things. So it's really important that we do things such as those that we're suggesting politicians do in question 4. You know, let's stop joint death. Let's do things that stop a person from losing that joint and requiring a very expensive total joint replacement and expensive aftercare and pain and disability and all of that.
Hopefully our audience can appreciate the value of these questions when it comes to an election, because a lot of times, although we know healthcare is always, you know, one of the top issues for voters, usually the information that you can find about it on a party website is their party platform and look under healthcare. And that's a document that will speak about healthcare in a very high level. You will see certainly information specific to spending on infrastructure, and that is building hospitals and things of that nature. But you won't see a lot of information about chronic disease management, let alone arthritis disease management. So these kind of core questions really force attention on issues that might not necessarily be explained in a party platform or in a a debate or in an interview on television or in a newspaper. So that's I think that's really why we spend so much time on this effort, is just try to get these issues at the forefront and try to get a well thought out response from political leaders.
Yeah, I mean, I'll just add to that, Kelly. Most politicians, if they don't live with a type of arthritis, don't understand that when you look, let's just say that the Alberta population is, you know, is water, it's an ocean, and there are icebergs in the ocean. And a politician sees only the very tippy top of the iceberg, which are acute care diseases that go to hospitals, right? Emergencies, internal medicine. So below the surface of the ocean are these massive bases of icebergs, and those are chronic disease. And they're no less important to pay attention to than the top that's sticking out of the water. In fact, they will be the stuff that's below the surface that will actually topple economies, like they would sink a ship. And so it's really, really important. Our process here, our election advocacy cycle, as we call it, is so critical to get that image in their heads and tell them, look out, you are only talking about these things at your town hall, but underneath that water is a world of hurt.
When it comes to the ocean and the icebergs in the ocean and our responses to those types of questions, what do we do with the responses once we receive them?
Yeah, so we bring those come into our director of programs and administration. They get posted to our website under the advocacy area, under the Alberta election page, and people can go in there every day prior to the election and see what their candidate is saying. And if they don't find their candidate there, Kelly, it's very telling, because it means they haven't responded. Responses, and they get put up on the website almost every day, if not, or every other day, but generally speaking, it's every day.
And we do,
And
and
then,
we always encourage our members, if they see that there is no response, we always
to
encourage them
write or
to
call the candidate.
directly ask them as well.
For sure, they can
Yeah,
attend a town hall, they can
yeah.
write a letter, write an email, absolutely. And then Kelly, come election day, we do send out an email that says, okay, here's what all of the candidates' parties said in the province. If you have time to have a quick read before you go to your polling place. And we run all of this campaign under hashtag vote for arthritis. So if we want to get arthritis on the healthcare map, on the healthcare policymaking table, we need to vote for it. So carefully study the responses, and then vote with your feet. Make sure that you let people know that you're interested in the answers that they gave specific to arthritis, no matter what the type. And then, of course, once the election results are known, ACE then writes to the party that is forming government and begins to share with them the work that we're doing, which is a product of the survey work that we do with our own grassroots 3 times a year, Kelly. So it's a really kind of beautiful cycle of tell me, tell you, help me, help you kind of things. So
Besides responses to the ACE survey questionnaire, what else they would find on the ACE Alberta election page?
yeah, so I think the thing that they're gonna find is contact information for the major parties. If people have comments or want to ask questions, they'll find links to Elections Alberta on how to vote. So, for example, a reminder about when election day is, advance polls in person, or voting by mail, which has become very popular in the pandemic. So there are links that follow this as well. Following this episode, there'll be a couple of screens that come up that direct people there, or they can simply go to www.jointhealth.org and click on the advocacy page. It's all pretty easy to find, but we're going to provide those resources at the end here.
Well, that's excellent. I think that was a good background for people, and hopefully a reason for them to get inspired and get involved, and most importantly, vote for arthritis on election day.
Hashtag vote for arthritis. You bet.
All right. Thank you so much, Cheryl.
My pleasure.
And thanks to you, our viewers and listeners, for joining us on another episode of Arthritis at Home. We'll see you again soon.